These exercises focus on flexibility, strength, and balance. You'll need a foam roller and a mobility wedge. If you don't have a mobility wedge, that's okay, but it definitely enhances the exercise. Foam rolling the calf and Achilles is a great form of self-massage. Doing this daily before activity can help to keep the ankle joint loose and mobile. Spend about 1 minute on each side. The next exercise utilizes the mobility wedge to strengthen the muscles of the calf and ankle. Doing eccentric calf raises, which means going up quick and down slow, can help to load the tendon of the Achilles and strengthen and bulk up the calf muscle. An added benefit is that the calf reaches up and attaches behind the knee, providing support there as well. Do 15 to 20 reps on each side. The next exercise is a balance activity that utilizes the mobility wedge as well. Place the low angle of the wedge on the outer portion of the midfoot. This helps to train the everter muscles. When we do this over time, it can help us to avoid inversion ankle sprains. Do 3 sets of 30 seconds on each leg. For these exercises, you'll need the mobility wedge and the long thin band. The 4-way ankle is a great way to strengthen the ankle in all 4 directions. First, we start with plantar flexion, similar to like a gas pedal motion. Push downward and do about 30 reps. Next, we have inversion, or swinging the ankle inward. Also do 30 into eversion, and then you can wrap the long thin band around something or have someone hold it for you as you do dorsiflexion or pulling your toes up toward the chin. After an ankle sprain, doing gentle stretching for the calf and soleus can help to improve the mobility of the ankle. Using the mobility wedge, place your heel on the floor and your toes on the upward angle of the wedge. As your knee stays straight and you lean into the wall, you'll feel a pull at the top of the calf. Hold that for 30 seconds. For the soleus stretch, bend the back knee and drop your hips straight down to the floor. Now you'll feel a pull in the top of the Achilles. This is targeting the soleus, the muscle under the calf. For these exercises, you'll need the Z slides, the long thin band, and the long thick band. The best way to prevent hamstring strains is to eccentrically load them. This first exercise has 3 different variations, starting from easiest to hardest. Fix the long thin band around something that will not move and put both of your feet on the slides. Lay flat on your back and slide both of your feet in quickly and out slowly. Do 20 reps. This next version adds a bridge, so we push our hips straight up toward the ceiling, and on one leg we hold tight. The other leg slides in quick and slides out slow. Again, this eccentrically loads the hamstring. This third version is the hardest. We bridge up with both feet, and as we maintain that bridge, we slide both feet in quickly, and then we slide both heels out slowly. Again, slide both in quickly, and then slide both out slowly. Do 10 to 15 reps. This next exercise is the best hamstring prevention exercise of all, the Nordic hamstring. For this, you'll need someone to hold your feet, or you'll have to wedge them under something that's immovable. Place your hands across your chest and maintain a straight line with your body. As you fall forward towards the floor, you'll feel your hamstrings engage. Hold tight and come back slow. Do 8 to 10 reps, but be safe because this exercise will make you sore. So as you move forward on each one, feel how far you can go and then come back. Each time, try and move forward a little bit further. After a hamstring strain, it's important to continue to work on the flexibility of the hamstring and hip. Using the long thin band, wrap it around the ball of the foot. Keep your legs straight and pull up towards your chest. Hold for 30 seconds to a minute. After that, you can also add straight leg raises, pushing down toward the ground to activate the hamstring. Another way to recover after a hamstring strain is to continue to work on your mobility and eccentric hamstring strength. Laying in the prone position or on your stomach, you can loop the long thin band around your foot and fix it to something that won't move. As you curl your ankle towards your butt, you'll feel the hamstrings engage. Do this quickly and let go slowly. Perform 20 to 30 reps on each side. Also remember, the further away you move from the fixed position of the long thin band, the greater the resistance will be. Adjust accordingly. Preventing groin injuries for basketball players is super important. These 2 exercises will help you do that. The first exercise utilizes the Z slides. Standing firm on one leg with a good knee bend, place your heel on the Z slide. Slide laterally outward and then push down into the floor and drag that foot back in. Again, slide out laterally, push down into the floor and drag that foot back in. This next exercise is called standing hip adduction, and it targets the adductor muscles or groin muscles directly. Fix the long thin band around something low and immovable, and standing on one leg, let's say your left leg, put the band around the inside of your right leg. As you're standing on one leg, slide that right leg over past the midline of the body and then back slowly. So quickly across the midline of the body and then back slowly. Now let's talk about recovering from a groin strain. As you can see, each time we're saying to recover from an injury, it's going to involve gentle stretching of the structures. One of the best ways to stretch the groin is to abduct the hips and let the legs fall out laterally. Place a Z-slide under each knee and ensure that your knee is located directly underneath your hip. Gently and slowly let your knees fall out laterally as you drop the midline of your body toward the floor. You're going to feel a strong stretch here in the groin, so do this very slow and very safe. Hold each stretch for 1 minute and do that 3 times each. This next exercise can help recover from a groin strain by activating the groin and strengthening the hips. Laying flat on your back, place the core ball in between your knees. Activate your core, squeeze the ball, and bridge your hips up toward the ceiling. Do 20 reps 3 times. The next injury we'll discuss are hip flexor strains. These can happen from having tight and weak hip flexor muscles or making an explosive movement to the basket. This hip flexor stretch utilizes a Z-slide. Place one slide underneath the knee of the hip flexor you want to stretch. Gently slide that knee posteriorly or backwards until you feel a stretch in the anterior hip. Once you feel a stretch and your body says stop, hold that position for 30 seconds. Once this becomes easy, you can raise the hand on the same side as the foot that is back for an extra added stretch. Do this 3 times 30 seconds on each side. For this exercise, get a low resistance mini band and place it around both of your wrists. Keeping your elbows tight by your side, your core tight, and your back straight, rotate both of your wrists away from the midline of the body or into external rotation. This will activate 2 of the main external rotators of the rotator cuff, strengthening up the back of the shoulder. This next exercise is called the wall clock. Again, get a low resistance mini band and place it around both wrists. Keeping one hand firm and stable against the wall, the other hand is going to reach as if it was reaching the numbers of a clock to the 2 o'clock position, 3 o'clock position, and 4 o'clock position. Keep the elbow straight and locked out. This helps to stabilize the scapula or shoulder blade, strengthen up the overall shoulder, and help prevent pain. Another great shoulder strengthening exercise is called horizontal abduction. Placing a mini band at the wrist, keep your elbows locked out and move your hands away from each other, feeling tension between your hands on the band. Slowly rotate both arms up into shoulder flexion and then back down again. You'll feel the tension in between your hands, but fight the resistance of the bands to pull your hands together. This next exercise utilizes the long thin band. Place it underneath both of your feet and in both of your hands, creating a square. With your thumbs up and your elbows locked out, raise both arms up into shoulder flexion, and then back down again. Do 20 to 30 reps. It's really important for this exercise that you keep your core tight and you don't arch your back. There's no need to bring your arms straight back past your head. This next drill is called scaption and is a great drill to strengthen many of the muscles around the shoulder and prevent new and further injury. Using the long thin band, place one part of it underneath your foot and the other part of it in your hand with your thumb up and elbow locked out. Find a tension that works for you just to bring your arm up to about 90 degrees. The angle of your arm and shoulder should be 45 degrees in between flexion and abduction. We call this last exercise band pull-aparts. Using the long thin band, grab it firmly in both of your hands and pull it straight across your chest, keeping your arms straight. This is a great exercise to protect your shoulders from wear and tear by strengthening the shoulder stabilizers and the upper back muscles. You know they're tough injuries to recover from and could sometimes last a long time. Here are a few exercises that can help you rehab. To target and strengthen the muscles of the wrist and hand, we need to isolate the flexor and extensor muscle groups. These grip strengthening tools come with the Z-Kit. If you don't have them, you can find alternate ways to do this. With the grip strengthener, place it in your hand, squeeze it slowly, and hold for 3 to 5 seconds, and then release it slowly. Do this for 30 to 40 reps. Following that exercise, we need to target the extensor muscle group of the wrist and hand. More commonly, these extensors are weaker than the flexor muscles, so this exercise will feel much more difficult. Place the finger web around the tips of each finger, keep them straight and locked out, and extend them as far as you can. Do this for 30 to 40 reps. This is a vitally important exercise for basketball players, as every floater, jump shot, and three-point shot involves wrist extension. This next series of exercises is a great way to strengthen the elbow, wrist, and hand. Using a long thin band, and as you can see Nelly is protecting his knee with the Z-slide, find a table or something to support your forearm. With your palm facing downward, bring the wrist up into wrist extension, similar to the motion of revving a motorcycle. Do 20 to 30 reps. Then flip your hand over with your palm facing upward, similar to a bicep curl. Let your wrist fall down and then come up into flexion. Do 20 to 30 reps here as well. Lastly, turn your hand to the side and let the pinky side of your hand fall to the floor and then come up, similar to the motion of a hammer. Do 20 to 30 reps here as well. Using the inflatable core crusher ball from the Z kit, place the ball firmly in your hand. With all 5 fingers spread apart, grip tightly till your fingers touch. Hold for 3 to 4 seconds and then release slowly. Do 30 to 40 reps on both hands, but specially isolate the hand that has the injury. One of the great features of the finger web is that it's easy to use for other exercises as well. If you have a finger injury on one of your fingers, you can use the finger web to isolate that finger and do flexion, extension, and abduction exercises with that. Here we see Nelly doing flexion exercises for a finger he previously has jammed. One great exercise is called the total knee extension, or TKE. This is a great functional exercise to gain quad control and quad strength. Take the long thick band and fix it to something immovable and place it just behind the knee. Let the knee relax and bend, and then forcefully contract the knee, giving yourself a strong quad contraction, and hold for 3 to 5 seconds. Do this for 20 to 30 reps on each side. This next exercise is called the Spanish squat, an extremely useful exercise as it reduces knee compression while heavily loading the quads. Fix the long thick band to something immovable, place both feet inside the band and back up until you have a strong resistance. Keep your feet closer than shoulder width apart and then sit your butt down to about 90 degrees. As you hold this, you will start to feel the front of your quads close to your knee burn. Hold for 15 to 20 seconds and then gently and slowly stand up. Do 3 to 5 sets of this, and once this becomes easy, you can start to hold the Spanish squat for 30 to 45 seconds each set. This next exercise isolates the glute muscle, a large primary mover muscle. When really strong, this muscle can help prevent ACL injuries. With a mini band around the knees, lay flat on your stomach. With your knee completely bent to 90, try to get the sole of your shoe up toward the ceiling. Do not let your hips rotate or come up off the floor. Do 30 reps on each side. This last exercise is a single leg squat performed on an incline using the mobility wedge. When we go down slow and we come up quick, we eccentrically load the tendons of the anterior knee and the hamstring. Do 10 to 15 reps on each side. There are numerous ways to prevent ACL injuries, and many of them we've shown you in this video. Calf raises, Nordic hamstring curls, bridges, and everything we've shown you in this ACL section.